episode of TC2, and we have Jay here today, and so we're going to get started with him.
I'm 28, trans man living with HIV. I work with the Detroit Health Department with the prevention, so to kind of help lower the risks and rates. I'm also involved with another great organization, or council I should say, known as CIMHAC. That's been really good.
Can you tell us a little bit about CIMHAC?
So CIMHAC stands for the Southeastern Michigan HIV/AIDS Council, in which we pretty much kind of like, I'm part of People Who Care, which is a subcommittee of the committee itself. And pretty much what I do is I kind of like help out with helping with getting events going and organized. Sometimes we come in contact with people who want to know more about HIV or how they can get condoms, like become a condom distributor. Also, I am a Project LEAP graduate, and I'm currently recruiting people to come be a part of Project LEAP this year. So I'm involved in a lot of things.
So when does Project LEAP actually start, the new cycle?
The new sessions will start in July. Don't remember the exact, I want to say July 11th or 12th. Don't quote me just yet. However, you can go to cimhac.org/LEAP, LEAP. The applications are online. They are available as of yesterday. So please, please, please tell a friend, bring a friend. We encourage everybody to come and be a part of. And basically what that looks like, just a little small brief of what it is. It basically gives you an idea of who and what Ryan White is, who Ryan White was as far as the young boy that started the foundation or whatnot, and what that program itself does now, all parts A through D. It breaks down a lot of all of that, how money is being allocated or whatnot, and currently we're kind of going into a little bit of the $281 million that is going into HIV care and funding.
Okay.
So we're kind of breaking that down a little bit too.
So you get to a better knowledge of where all the money is allocated to.
Right, where it's coming from, where it's going to. And we sometimes get the opportunity to be able to, I wouldn't say that we kind of get the opportunity to adjust some of that, but if we know that certain places are kind of lacking a little bit, and it may not be us, but we have the ability to be able to go contact these people and say, hey, here in, say, this county that we serve, because we serve 6, including the city of Detroit itself, they need a little bit more help over here in this area. We've already extended our budget. We're good. We got enough to hold over, either to next year, or we can give it to somebody else. Can we give it to somebody else since they need it more than we do? So, we just kind of work on stuff like that.
Okay, that sounds awesome.
Yeah.
It sounds like a good program, especially if you're getting into doing advocacy work. You know the intercults that goes on behind with the Ryan White program, and also with H.E.R and the support services that are out here.
Oh yeah, we definitely talk about the services and lack thereof.
So when did you actually start your journey?
So for me, I came to the realization when I was young. I was probably in about 4th or 5th grade. When I started playing around with different names or whatnot, I really I had certain feelings, and there were certain activities that I was doing in which I also felt like everybody in my family knew, but nobody could just outright say, oh, this is who he is. It was one of those things that my grandma knew before I knew, but she just wanted me to become old enough to understand and find out myself instead of try to force it down my throat and it not be something I'm okay with.
Right.
So yeah, it was more than just the tomboy things of climbing trees and scuffing up my knees kind of thing. It was I just moved differently. I never really I was never fascinated with Barbies. Give me a G.I. Joe and we're great. Give me my Tonka trucks and we're cool. So it was like small things like that as a child. I didn't medically transition or start medically transitioning until I was 21, 22. And that was because I was born and raised in North Carolina, and I had to go somewhere where access was more available. And even then, there wasn't as much access as there is today, but there at least was something. And that's kind of just what I was going for, something.
Okay, so what has been your biggest struggle you have had to face as a trans man?
So the shift in getting people to use the proper pronouns. Many people have known me as Jay before I had my legal name change done, and nobody really had an issue with just calling me Jay. Like, nobody questioned it or anything like that. So it was more so once I actually got my legal name changed, it was trying to get everybody who wanted to continuously dead name me, which is, for those who don't know, is basically call me the name that I was assigned on my birth certificate. And to basically try to keep getting people to understand, like, you have to call me Jay now. You have to address me as he, him, guy, male pronouns. You don't really, you're not understanding that what you're doing is inflicting harm on me. You're putting me in danger. You know, we may be, especially for if I'm having just a regular conversation, say out in the public, I don't know, and you don't know what the next person around us might be hearing, thinking, or any of that. Because let's face it, a lot of people ear hustle. So if for you to turn around and possibly either dead name me or misgender me puts a target on me, like, and we don't need that, you know.
So do you think that as a society, because I know things are becoming a little bit more acceptable in our society as far as bringing the trans population more into the fold with things, but do you think it needs to be more cultural competency emphasized with the trans population with everybody else?
Yes, I definitely do. I think it needs to be a lot more in-depth conversations. I get that it, especially from like region to region, everybody's a little bit different as to how they go about like disclosure and stuff like that. And I don't mean just disclosure on HIV status, but just disclosing that you're trans or gender non-conforming or whatnot. I think that for me personally, I'm a very open individual. So for me, I don't consider certain questions as being too invasive or too personal. I get that there are a lot of people who do think that, but I feel like if we don't talk about these kinds of things, now some things are totally inappropriate, like, you know, are you considering getting, you know, bottom surgery done, whether you're a trans man or a trans woman? That's just totally inappropriate. That's none of your business. But like other questions like what we're talking about now, I think that people should be able to have these kind of conversations and it not be a big ruckus about it. The only way that people are going to be able to know more about us, learn more about us, and eventually at some point respect us a lot more is that we have to talk about it. We have to
normalize it. So
exactly. We have to make it like a regular conversation. Like, we're talking about music, we're talking about art, we're talking about trans people.
So during your journey, do you feel that you have always received appropriate services when it came to your health care?
Oh no.
Why do you not feel that you did?
Well, I mean, I noticed that I didn't in certain situations. There was a really tragic situation that happened when I first moved up here in 2010. And I had to go through the emergency room hospital. And basically, long story short, I was a rape survivor. And I don't like to use the word victim. And when I went into the hospital and I tried to explain to them what was going on, what had happened, you know, prior to them giving the whole rape kit test and stuff like that, I was constantly misgendered, constantly misnamed. I told them that I was trans. I told them that my pronouns are he, him, his. And it got to a point where they just left me in the room after doing the whole rape kit and whatnot and turned off the light. didn't even come back in there for hours.
So it was
I ended up walking out.
So it was almost like you felt like you was being re-victimized, but just in a different way.
Oh yeah, I was re-victimized, and then I was just like, I felt like I was being left there for dead, even though I wasn't gonna die. But it was, you know what I'm saying, that feeling of like, okay, y'all done came in and did everything that y'all wanted to do, and then you close the door, turn off the lights, like
almost like you were nothing.
Yeah. So that to me was an issue.
Well, I'm sorry that even happened, but then that goes back to what I was saying. We have to, as a society, start normalizing things, because I think as long as we don't normalize things, it's always going to be these stigmatizations around certain things. And if we're bringing, the trans community into the fold, we have to be able to normalize things,
right? Because
everybody's human beings. We all should be able to coexist with each other and respect each other, and that's the bottom line. So I would take it. That's one of your worst situations that's ever happened with healthcare.
Yeah, that's one of my worst, if not the worst situation. Yeah.
And what has been your best experience with the healthcare?
My best experience with healthcare is having my primary care physician right now is the greatest. She didn't really, she originally started off as a pediatrician and then decided that she wanted to help trans people. And I appreciate and commend her for that, because a lot of doctors don't want to step out of what they already had original passion for. So for her to turn around and just say, okay, not only do I want to help kids and youth, but now I can help these, I don't want to say special individuals, but we are pretty unique as hell. I appreciate that, you know what I'm saying? And she does know what she's doing. She's very well knowledged. And then not only that, after she became so good at what she's been doing, she's turned around and helped other doctors and put them on to being able to be really good providers like she is herself.
Well, I'm glad you finally was able to find somebody that you're comfortable with.
Oh, yeah.
Because I think that's a huge issue. If you are not comfortable with your providers, a lot of times you're not going to ask those questions that you need to be asking. And two, a lot of times you're not going to go get the care that you need unless you really are in dire straits, and then you need to follow up with somebody. Do you think that your healthcare provider does proper screening of your biological reproductive organs?
Yes, because as a matter of fact, we just had a doctor's appointment yesterday. That's got to be a thing. Trans men, I cannot stress this enough to you all. And those of you all who are partners of trans men, I encourage you all to let them be aware of this as well. I understand that a lot of us, our dysphoria lies within our bottom region. We still, and even as myself, a man who's had a full hysterectomy done, I still have to go out and get a pap smear done. Because there are still things like HPV that you may have to worry about. Understand that cervical cancer or HPV itself may lead to cervical cancer, but that's not the only thing. I was informed yesterday that you can have issues with like throat cancer or whatnot if it's not treated. But just knowing that you may have a possibility of an abnormal pap smear period, regardless if you are receiving penetration or not. Like, please keep up with that, because at the end of the day, us being on testosterone for so long, we don't produce, I'm 7 years in, we don't produce the same amount of vaginal secretions anymore. That's normal, so if you're still having penetrational sex, you're possibly putting yourself at risk of other things, because especially if you're not using lube, those are some things that, a lot of people are just like, I don't feel like I have to, I'm good on that. But there's a whole reason why those things are put in place. So you don't harm yourself, you don't risk yourself of getting an infection, a bacteria infection or whatever, you know what I'm saying? Things can happen.
So at this time, do you know your status? And you might have briefly stated it at the beginning, but can you just reiterate it if you don't mind to the audience?
I do know my status. I have been living with HIV since January 23rd of 2017.
Okay, and do you know how you might have contracted and how you was exposed to it?
Yes. So, contrary to popular belief, at one point in my life, I was doing survival sex work, but it was not transmitted to me via a client or a date. It was transmitted to me via my long-term partner of 7.5 years.
Wow. So
she failed to disclose.
I was about to ask you, had she ever told you that there was a possibility?
No. Both of us were also active survival sex workers or whatnot. So one thing that, and I don't want to say that this is what all sex workers think, okay? But for us in our situation, we have always had that fear of one day it's possibly going to come around. But we have been going for so long, and like with us in our dates, or our clients, I would always use protection. She sometimey or whatnot, but even on her sometimey moments, she would let me know like, hey, I had to, whoop-de-dee-woo with this person and we didn't use protection. Okay, we about to go to the clinic. You know what I'm saying? I was really one of those.
That was my next question. How often did you guys go get tested together?
Oh, we went pretty often until she got sent out of state.
Okay.
Once she got sent out of state, for different reasons or whatnot that I can't really disclose, then that's when it kind of went a little bit different. She said that a date went bad, basically is what we'll call it. And that's when she believes she may have, but she don't know. And she never went and got tested afterwards. Like, she never went to the hospital after the situation happened. She didn't do anything. And she's still walking around like, well, I might, but I might not. But then again, I don't care. So she's kind of really like nonchalant about it.
Wow. Okay.
Very much in denial.
So how do you feel your care and services have been since you found out?
Pretty good. I have to say, surprisingly. Now, in the beginning, it was a little difficult. And it wasn't because of my primary care provider or the people who had tested me or anything like that. It was my EIS services at first.
Can you explain to everybody what EIS means?
So EIS is basically early intervention specialist. Most of the time that when people become diagnosed with HIV, you have the ability to get linked into CARE, Linkage to CARE or Link Up Detroit. Shout out to them. And they will help you with somebody that will be able to kind of help navigate you into getting your prescriptions. If you need help with, say, housing, food, things like that, those kind of resources, anything that will help you along the way, that's what they're there for, at least the early parts. Like, so yeah, you're diagnosed with HIV, but like, what else might you have going on? Like, are you...
So they look at all the barriers that you may have.
Yeah, they look at everything.
And I think that's important, because if people have barriers, in place, a lot of times they're not going to be inclined about going and getting the medical care that they need, or even taking their medication. Because if I'm homeless, that's going to be the last thing I'm going to be thinking. The last
thing I'm thinking about, because for one, I don't even have nowhere to store it. And then not to mention, like, we're not going to get into the whole criminalization laws and things like that. But, I can't just walk around with my treatment medication in my book bag. My girls can't walk around with their treatment medication in their purses. You know what I'm saying? Because it's a whole thing behind that.
Right,
That's Michigan.
So how are you now? How are you doing?
I'm great.
So are you going and seeing the doctor?
Oh yeah, I see my doctor. So the regulations recommend that I see my doctor once every 6 months. But my doctor is thebomb.com, so I go see them like maybe once every 3 months. Because even before I got diagnosed with HIV, I was always, because of the fact that I was an active sex worker, I was always getting tested. I always made sure I got tested every 3 months. It was a thing for me personally. So I never got out of that routine, even though now I don't get as HIV testing every 3 months. I still get all the other screenings done.
Okay.
That's another thing that I want to try to like let people know that, okay, yeah, you have HIV, but don't forget that there's other things that you have to worry about as well now that your immune system is compromised.
Right.
You're more susceptible to a couple of things that you may not have been susceptible to before.
Right. Correct. So do you feel most healthcare providers are culturally competent with the trans population?
Keyword most? No.
Okay. And what do you think is lacking?
So, and it's a little iffy, a little touchy, but I don't think, so to my understanding, they're getting the cultural competency trainings. Like, the trainings are being given to the people.
Mm-hmm.
I think people's personal biases
plays into that.
Plays into it.
Oh, yeah, because, I mean, if you were raised that, if whatever the person's religious or you know, cultural backgrounds are, that I don't care how much education sometimes you give people, those biases are still going to stay in place.
Absolutely.
But the only thing I can say is you still got to put the awareness out there.
Yeah.
Maybe sometimes there might be that fish that may catch that hook and decide, hey, this isn't right. I need to be a little bit more open-minded about stuff.
Right. And see, that's what I say for most doctors, no. Like I said, I believe and I know for a fact, because I know 3 really good organizations in the area that do cultural competency trainings, and they have trained these people, they've trained these individuals and the staff. But again, it goes back to like what we were saying, the biases, the religion part is a big chunk because of it being a conservative state.
So, how would you like to see changes within your community?
How would I like to see changes within our community? I would like for people to understand that HIV is not a gay man's is not a gay man's disease. Okay. HIV is not something that we are going to die from today. Okay. There are a variation of medication treatments that are now available. Back in the late 80s, early 90s, they only had one pill, and that was AZT. AZT was killing people quicker than it was healing them. Today, we now have, I want to say it's like maybe 8 or 9 different variations of treatment that can help out. I know for me and my journey, I first started off with 3 different pills, and now I'm down to 2. One was to help boost my immune system because I had a very, very low CD4 count, and my viral load was extremely high as hell. So the 2 treatment pills that I used to suppress the viral load worked really great, and the other pill that I had to take to boost my immune system was only something I had to take until I got to a certain level that was like, okay, now we can just utilize these 2 pills to suppress the virus and also keep your immune system great.
Okay.
But that's the thing too. Some people can get the 1-a-day pill. They are now trying to do study trials for a shot form, and so it's like medicine and technology are doing this thing. I appreciate it a lot.
Okay. And so how long have you been virally suppressed now?
Let's see, what is this? March, almost April. Oh, it's April. 2 years.
Okay, that's great.
March 27th made 2 years.
And a lot of that is going to contribute to you having an awesome doctor.
Yes.
And you adhering to your medication.
Yes.
And
I mean, and don't get me wrong, like, even though, because I'm quite sure some people are questioning, like, okay, well, you got diagnosed in January, but you didn't start doing treatment until March. Yes. I will admit that I was one of the very many people that it happens to very often. This ain't me. This ain't my reality. There's no way in hell. You know what I'm saying? Like, I was living in denial for a very long time. I didn't care. I didn't like myself. I didn't like life. I didn't like people. I wanted to be away from everybody and everything for, like, my first 3 months. And it wasn't until I talked to somebody who went through a similar situation like myself. I used to have a really bad pill addiction in my younger teen years. And it wasn't until I talked to somebody else who also had that situation going on and also had that same kind of past that was like, you have to start looking at them like, these are vitamins. This is going to keep you healthy. You know what I'm saying? You can't look at it like, oh snap, you might, you know what I'm saying, go back to your old ways.
Mm-hmm.
These are the kind of pills you kind of want to be addicted to. You know what I'm saying? Not that there is any addictives to it, but I'm just saying. Yeah, so it wasn't until I came in contact with that person and had that conversation with him that it made me feel more like, okay, I can do this. I can gain control of this.
And I think that's the key, too. It's like, yeah, you receive this diagnosis, but life goes on.
Oh, yeah.
And also having a great support system behind you, I think is key to also helping you stay compliant with your meds and also staying virally suppressed.
Right.
It's having a good support system all the way around.
Right. And see, that's the thing, too. I have a lot of great gay male friends. I have some cis hetero women friends, trans women friends and whatnot that are going through this. The only thing that I don't like so far in my journey is that I am the only trans man in the city of Detroit and within a 6-county radius that's going through this, documented that is. So that's the only thing that I'm kind of like, damn, I don't have nobody that's like exactly in my shoes. Like, you want to like, for instance, one of the issues why I haven't been able to receive my top surgery yet is because until my CD4 count gets to a certain window range, they won't put me under the knife again.
Okay.
Because they want to make sure that, you know,
you're
my body will properly heal afterwards. Right.
And then that's another question, and that'll be my last question.
Okay.
Do you think a lot of insurances nowadays have gotten a little bit better?
Oh, yeah. Shout out to Chicago. Baby, shout out to Illinois.
Okay, but how about for Michigan?
Listen, I'm hoping that because Illinois done sat here and made change, I'm hoping that, you know, it'll just blow over here to Michigan and Michigan will finally get with the program. I don't know who all, like, as far as, like, if it's, like, politics or people we gotta call to make that a thing or whatnot. But I know, shout out to our Attorney General right now because she is thebomb.com and she has definitely helped out the trans community a lot before she became the Attorney General today. So I'm hoping that with everything else that's been turning, also
the insurances will be a lot better as far as approving for
I'm hoping so.
Those
because like I said, Illinois done did it, and Illinois is, I believe, the 13th or 14th state in the U.S. to allow Medicaid, Medicare, and any and all insurances to be able to start covering GSRs. Okay. I mean, GRSs.
All right. Any final thoughts? 1 minute final thought, Jay.
No, you guys be easy, be greasy, be peasy. That's about it.
And make sure you go on SimHack's website.
Oh, yes, please. Make sure you go on SimHack's website. That is semhack.org/LAP.
So thank you so much for coming back again. We appreciate it. I think this interview was a lot better than our first one.
Yeah.
All right. You take care, hon.
All right.